Welcome to Blue Water Health's pre-surgery intake and assessment class for patients receiving hip replacements by Dr. Matlovich. Outline. Today you will learn about your surgery, what to expect after surgery, and how to prepare beforehand to achieve the best possible outcomes. There will be a short quiz at the end of the presentation to ensure you understand all of the information. Please take a moment to read each slide, as some of the information may be different from what is being discussed. Preparing for surgery. Preparing for surgery. Possible equipment needs. There is a lot of helpful equipment that will improve your independence after surgery. The occupational therapist will recommend equipment for home based on your functional status after surgery. This list may include a standard walker, cane, crutches, raised toilet seat or Versa frame, shower chair or tub transfer bench, a reacher, a long-handled shoehorn, a sock aid, or elastic shoelaces. Preparing for surgery. Rental purchase locations. There are a few local stores that may be able to rent or purchase equipment if needed. They are listed on this slide. If you are from out of town, please review the stores in your local phone book or research them online. You can also sometimes find equipment through a local Legion, service club, or from family and friends. The Red Cross no longer rents equipment. Preparing for surgery. Your home. To prepare for surgery, it is also important to modify your home environment to ensure you are safe when you return after discharge from the hospital. If you live in a multi-floor home, it may be easier for you to stay on the main level while you recover. Since you will be walking with a walker after discharge, it is important for you to make sure you have clear pathways around your home to allow for space for you and your walker. You may need to move furniture to create clear pathways, eliminate trip hazards, including items on the floor and scatter rugs. Driving and car transfers. Typically, you will not be able to drive for 6 weeks as per your insurance policy after surgery. Please get direction from your surgeon regarding when it is safe for you to drive again. We have listed some advice on how to enter your vehicle. Preparing for surgery. Community supports. Before your hip surgery, you may want to arrange for transportation. If you anticipate you may have difficulties or you live alone, you may want to look into assistance with meals or prepare meals before your surgery. You could also consider asking someone to stay with you or stay at their home if you have a difficult home to get around. Preparing for surgery. Respite stays. Home and community care are able to help you navigate any concerns you may have after you discharge home from the hospital, including respite stays. For more information, please contact Home and Community Care at 1-888-447-4468 or visit them online at eriestclairhealthline.ca. Preparing for surgery. Exercises. Before your surgery, you can do exercises to strengthen your legs to prepare for and make it easier for you to move after surgery. Please make sure your focus is on exercises that are within your pain limits before surgery. While in hospital. Parking. Blue Water Health has parking available with a maximum daily rate of $7 per day. You can also purchase a parking pass before surgery if your family is planning on visiting you daily. This is available at patient accounts behind Tim Hortons in the atrium. While in hospital, pain control. After surgery, our goal is pain management, not elimination. The team will provide you with pain medication to keep your pain under control and allow you to complete your rehabilitation. While in hospital after surgery, your rehab team will provide you with equipment to use while in hospital, including a reacher, shoehorn, standard walker, and equipment for you to do physiotherapy exercises, as well as learn strategies for personal care tasks. Please do not take this equipment home with you when you leave. After you arrive back on the floor that evening, the nursing staff may get you up into a chair or help you walk to the bathroom. While in hospital, after surgery, anterior approach. Approximately 4 hours after surgery, a physiotherapist will see you and help you through your first set of exercises and get you up for a short walk. If you had a lateral approach for your surgery, nursing staff will assist you to walk a short distance or transfer to a commode chair. While in hospital, walking. Physiotherapy will help you resume your walking after surgery. Most people use a standard walker to start. The pattern is always walker forward first, then step with your operated leg, then step with your non-operated leg. Over the course of your hospital stay, an occupational therapist will complete an assessment as well as review functional transfers, strategies for getting dressed with or without adaptive aids, home management techniques, and car transfers. They will also identify any additional equipment you may require for home at time of hospital discharge. While in hospital, after surgery day 1, physiotherapy will get you up and walking. Orders from your surgeon will be reviewed, and we will let you know how much weight you're allowed to put on your operated leg. We always bring a chair behind you when we head down to therapy for safety. While in hospital, after surgery day 1, physiotherapy will ice your hip for pain control, measure your hip range of motion, and communicate your mobility and range of motion to your team members on the whiteboard located on the wall close to your bed. While in hospital, physiotherapy, after surgery day 1. If you had an anterior approach surgery, physiotherapy will see you to complete range of motion and strengthening exercises, get you up walking, and practice going up and down stairs prior to your discharge home. If you had a lateral approach, you will complete range of motion strengthening exercises with therapy staff in the morning and afternoon. While in hospital, after surgery day 2, you will continue the same exercises as the day before, but you will increase the repetitions and practice the stairs. You can continue to practice dressing with adaptive aids as needed in order to ensure you are independent before returning home. Stairs. Physiotherapy staff will practice stairs with you. All you need to remember is up with the good and down with the bad. Discharge day. Most patients discharge home on day 2 after surgery, not including the day of your surgery. For example, if you had your surgery on Monday, Most people are discharged home on Wednesday morning after therapy. Your nurse will go through all of your discharge instructions and the occupational therapist will review any equipment recommendations. After discharge. After discharge physiotherapy. After you are discharged home, you will be expected to continue the exercises you were doing in hospital 3 times per day. Please continue to walk with the standard walker and do not start using the cane until you are advised to by the physiotherapist you are working with in the community or your surgeon. After discharge outpatient physiotherapy and home care physiotherapy. Your doctor may or may not order physiotherapy in the home. This is based on how well you are progressing after your surgery. All patients should have their outpatient physiotherapy booked for 7 to 10 days from the date of your surgery. If you're coming back to Blue Water Health, we will set up an appointment for you before your surgery. What to expect. What to expect. PROMs, or patient-reported outcome measures. You will be asked to complete some surveys along your journey with us at Blue Water Health. They will take 10 minutes to complete and provide us with valuable information about your health and management after your hip surgery. What to expect. Your incision. Your incision will be closed with staples. The staples will come out approximately 14 days after surgery. When you leave the hospital, you will have a bandage on your incision. It is to stay on and is only to be changed if it gets wet or falls off. You cannot bathe until the staples come out. Plan to sponge bathe for the first 14 days. Please monitor your incision for signs and symptoms of infection and notify your surgeon if you are worried you might have an infection. Please refer to your total hip booklet for a list of signs and symptoms of infection, which may include increased redness, swelling, and fever. What to expect. Gait aids. Most people quickly transition from a walker to a cane, and by 4 to 6 weeks, most people are not using anything to help them get around. What to expect. Pain. Please use your pain medication, rest, and ice to manage your pain. You should expect to have some pain, swelling, and tightness for 6 to 8 weeks after your surgery. Quiz. Please take a moment to take the quiz below and test your knowledge on your upcoming surgery.